Alright, thank you very much. My name is Mr. Jake. Today we're going to study OET Reading Part B, Test 3. If you are new, I have old videos. You can watch them, and this is going to help you. Let's form strong community. Be a loyal member. Subscribe, like my videos, and share the videos. Let's go to the quiet room and solve the questions on the whiteboard. My name is Mr. Jake. I'm your facilitator. In this part of the test, there are 6 short extracts relating to the work of health professionals. For questions 1 to 6, choose answer A, B, or C, which you think fits according to the text. Question number 1. The policy document tells us that prescribing stop date. Prescribers should write a review date or stop date on the electronic prescribing system EPMA or the medicine chart for each antimicrobial agent prescribed. On the EPMA, there is a first entry for stop date on oral antimicrobials. There is not a first stop date on EPMA for IV antimicrobial treatment. If the prescriber knows how the course of IV should be, then the stop date can be filled in. If not known, then a review should be added to the additional information. Example, review after 48 hours. If the prescriber decides treatment needs to continue beyond the stop date or course length indicated, then it is their responsibility to amend the chart. In critical care, it has been agreed that the routine use of review or stop dates on the chart is not always appropriate. Alright, this extract is about prescribing stop date. So the focus is on stop date, and we can see over here antimicrobials. Okay, they need to write a stop date. Okay, stop date on our oral antimicrobials. But when it's IV, there's an option here. If the prescriber knows, okay, then they can fill in the stop date. If they don't know, if not known, then that means they can do review after 48 hours. And when it comes down here in critical care, okay, review or stop date is not always appropriate. So it means stop date is not always applicable or applied to antimicrobial, all kind of antimicrobial medications. Okay. Question number 1. The policy document tells us that option A, stop dates aren't relevant in all circumstances. Alright, based on what we said, because it is given, it can be written for oral antimicrobials and also for IVs if the prescriber knows, and also if not known. So this is conditional. Okay, then also in critical care, it is not always appropriate. So which means it is not all every circumstance that you can apply stop date. Now B, anyone using EPMA can disregard the request for a stop date. This is wrong, because here we have prescribers should write a review date or a stop date on the electronic prescribing system EPMA. This is like a statement of command, so you cannot disregard it. C, prescribers must know in advance of prescribing what the stop date should be. So it's like here, because we have if the prescriber knows and if not known, this statement, okay, makes it wrong, because there's a conditional statement here. Prescriber are allowed, they have some window of opportunity to make prescription to review. So the best option is A. Question number 2. The guidelines inform us that personalized equipment for radiotherapy, guidelines, radiotherapy simulation planning appointment. The initial appointment may also be referred to as the simulation appointment. During this appointment, you will discuss your patient's medical history and treatment options and agree on a radiotherapy treatment plan. The first step is usually to take a CT scan of the area requiring treatment. The patient will meet the radiation oncologist, the registrar, and radiation therapist. A decision will be made regarding the best and most comfortable position for treatment, and this will be replicated daily for the duration of the treatment. Depending on the area of the body to be treated, personalized equipment such as face masks may be used to stabilize the patient's position. This equipment helps keep the patient comfortable and still during the treatment and makes the treatment more accurate. So, based on this short extract, we understand that it is about how radiotherapy is done. Okay, so first of all, you will be asked to take CT scan of the area. Then you will meet the medical staff who will give you information about the treatment, and so they will give you a personalized equipment during the day of the treatment, and this will help you keep comfortable and remain still during the treatment for the treatment to be more accurate. Question number 2. The guidelines inform us that personalized equipment for radiotherapy. So our main focus is on personalized equipment, the purpose for the personalized equipment. Then when you go through the extract, you can clearly see that we have personalized equipment here. So let's start. Personalized equipment such as a face mask may be used to stabilize the patient's position. This equipment helps keep the patient comfortable and still during the treatment and makes the treatment more accurate. Okay, so the option A is advisable for all patients. That is not the main purpose for personalized equipment. B, improves precision during radiation. So to make the treatment more accurate, precision. I think this makes more sense. Then C, needs to be tested at the first consultation. It was not indicated there. So the best option here is B. Alright, thank you very much for watching this video. I have more recordings to present to you. Thank you. My name is Mr. J. Expect more from me. Bye bye.